Renowned welcome everyone to our annual general meeting. Before we begin, I would like to provide a brief technical introduction. Today we are using Microsoft Town Hall. This offers you the opportunity to see live subtitles of the proceedings today. You should see a button in your settings to switch on subtitles. Subtitles for today's meeting are available in Cymraeg and English, as well as Polish, Ukrainian and Urdu. Please note that these subtitles are generated automatically from spoken English. Sections of our presentation given in Welsh will not produce correct subtitles, but the speaker will use both the Welsh and English to ensure that nobody is excluded. Teams also allows the opportunity for people to raise questions. On your screen, you should see a tab with a question mark on it. This will normally be in the top right of your screen. If you click on this, it will give you the opportunity to ask a question. And please note that there is approximately a 2-minute delay on the live broadcast. So please accept our apologies that we may not be able to answer all of the questions that we received during today's meeting, but we will continue to update our website with the latest information about the Health Board's plans and priorities. Today's meeting is also being recorded. Don't worry, this does not share information about you in the audience, but just the information that you see broadcast on the screen today will be visible. This means that people who are not able to join us this afternoon will still be able to watch today's AGM at a later date. Thank you very much for joining, and our AGM will now begin.
Good afternoon, and on behalf of the board of Powys Teaching Health Board, it's a great pleasure to welcome each and every one of you to our annual general meeting for the year 2023 to 2024. And in accordance with Welsh Government requirements, we are holding this AGM by the end of September. Felly braf iawn ydy cael eich cwmni heddiw ar gyfer ein cyfarfod cyffredinol blynyddol. A diolch yn fawr i chi am eich presenoldeb. Cal Cwpr ydw i, sef cadeirydd y bwrdd, ac dwi'n falch iawn ochr yn ochr ac Eili Thomas, sef ein prif swyddog gweithredol, i gael cyfle ac i allu rannu efo chi a gyflwyno i chi ein hadroddiad blynyddol. Fel dyn ni i gyd yn gwybod, ynde, mae di bod ac mae'n dal i fod yn gyfnod heriol iawn i'r gwasanaeth iechyd, ac dydy pethau ddim yn wahanol ym Mhawys. Serch hynny, mae ein hadroddiad blynyddol yn amlinellu meysydd hynnydd pwysig sydd am wn i yn adlewyrchu ysbryd cydgynhyrchu a phartneriaeth sydd gennym ni yma ym Mhawys. As chair of the board, I'm really pleased today, alongside our chief executive, Hayley Thomas, to be able to commend to you and to share with you our annual report. We're all aware of the great challenges that the NHS faces currently, recently, and indeed that we continue to face. And Powys is no exception. However, our annual report outlines some very important areas of progress that I believe reflect the spirit of co-production and partnership that we have in our county. I want to start with positive news. At the beginning of the year, the World Health Organization made the official declaration of the end of the global emergency status in connection with the COVID-19 pandemic. However, the impact of the pandemic and the impact of that period is very keenly felt still by everyone, by our patients, our communities, by our staff, and our partners, both in relation to the health and well-being impact, but also, and very importantly, through unacceptably long waiting times that we continue to experience for planned routine care. And these impacts are compounded by the socio-economic consequences of the ongoing war between Russia and Ukraine, a cost of living and inflationary pressure crisis, and an ongoing challenging environment for the recruitment and retention of staff, particularly in sectors like domiciliary care. 2023 and 24 also experienced industrial action in the NHS, yes, in Wales and indeed beyond Wales. And a number of national pay disputes continued throughout that year. But notwithstanding and despite these challenges, in Powys, we've been able to continue our journey from pandemic response to focusing on our medium to long-term strategic goals set out in our health and care strategy. And in just a couple of minutes, Hayley, our Chief Executive, will take us through the journey that we travelled as she presents to us the annual report. Just a word also about our financial position. We ended the 23-24 year in a deficit position, albeit that we met the financial target that Welsh Government gave to us. But what that meant is that Welsh Government escalated the Health Board from routine arrangements to enhanced monitoring for planning and for finance. And that happened back in September 2023. I think it's important to point out that we remain in routine arrangements for every other aspect of our delivery as a health board. And following our Chief Executive, our Deputy Chief Executive and Director of Finance, Pete Hopgood, will explain to us the financial journey and the situation as regards the financial context. Ond cyn diwedd y cyfarfod heddiw, mi fyddwn ni yn croesawu unrhyw gwestiynau sydd gennych chi, aelodau o'r cyhoedd, i'w gofyn i ni, ynde? Ac fel mae tab eisoes wedi esbonio, a fyddwch chi cystal os gwelwch yn dda, ac ychwanegu neu postio eich cwestiynau yn swyddogaeth holi ac ateb ar y platfform dyn ni'n defnyddio heddiw. Ac mi fyddwn ni yn ateb gymaint o gwestiynau ac y gallwn ni heddiw o fewn yr amser sydd ar gael i ni. So as Tab has already mentioned, we are welcoming today questions from the public. Please do post those in the Q&A facility on this platform. I think probably it's worth mentioning that we will all be aware, I'm sure, that currently as a health board, we are considering some proposals in connection with possible temporary service changes to our minor injury units and to our community hospitals. The engagement period for those proposals closed on Sunday of last week, the 8th of September. And as a board, we will be giving consideration to these recommendations in our meeting, which will be held in public on the 10th of October. So at the moment, work is taking place in order to collate and to analyse all the feedback, everything that was said to us and all the correspondence we had in relation to those proposals. So we don't intend to spend time today on those temporary changes, but I just wanted to give public assurance that as a board, we will be giving full, comprehensive, conscientious consideration to those proposals on the 10th of October. Ac felly, fel wedais i, postiwch os gwelwch yn dda unrhyw gwestiynau eraill ar y platfform ac mi fyddwn ni yn gwneud ein gorau glas I ateb gymaint a gallwn ni. So please post any other questions in our Q&A facility and we will do our best to answer them. But without any further ado, I'm going to hand over now to our Chief Executive, to Hayley Thomas, who will present our annual report to us. Diolch, Hayley.
Diolch, Carl. Croeso pawb, a Diolch yn fawr iawn am ymuno â ni heddiw. Mae'n anrhydedd cael y cyfle i gyflwyno'r adroddiad blynyddol. Byddai yn cyflwyno rhai o'r uchafbwyntiau i rhoi tymed bach o blas i chi o'r gwaith a rhai o'r cyflawniadau yn ystod y flwyddyn. Welcome all, and thank you very much for taking the time to join us today. It's a real honour to present to you Powys Teaching Health Board's annual report for 2023-24. Unfortunately, I'm only able to really provide a snapshot of the content to offer you a taste of the achievements. I'm extremely proud of the organisation and how colleagues have raised to the many challenges, and the annual report, I hope you'll see, is a good read that clearly highlights both the challenges that we face, but also the success and good work that have been undertaken by the organisation, by our partners in primary care, by our partners across health and social care in Powys and further afield, and importantly, our volunteers and the broader communities that we work with across the whole system. It's been a real privilege to me to have been appointed as Chief Executive, and you'll see through the examples that, and on behalf of the board, I'd like to sincerely thank everyone for their dedication, commitment and hard work, which I see in bucket loads throughout the organisation on a daily basis. Before I start highlighting some of the achievements, I thought it would be helpful to just remind us that the Health Board is responsible not only for providing a range of services, but also we commission health services on behalf of the population of Powys. And I know that all of us who live or work here will know some of the challenges that we face, including the rurality and being the most sparsely populated county in England and Wales. But we do provide an excellent range of services across both primary care, which is the front door of the NHS and really important, our community services, both within people's homes, but also across our community hospital and sites, and importantly, the role we play in providing mental health services. We know in Powys that people live longer in good health than the average for Wales and the UK average, but also we are very keen as a health board to ensure that we're tackling inequalities within the county too. Our demographics pose some challenges for us. Powys is clearly at the forefront of an increasingly older population, and currently we have 28% of our population who are over 65 years of age, and we look at the projections over the next 10 years that will increase substantially. So this is good news. This means that more people are living longer, but we also have to deal with increasing ill health, multiple conditions, and demand for health and care services continues to grow. I think also you'll see from the wellbeing assessments that we've undertaken that a third of people in the county live alone, and we know the devastating impact that loneliness can have on ill health. So again, some of these challenges are really important for us to address. We also work very closely in partnership with a number of providers across the county council, PAVO, the third sector and independent providers, but also we purchase services from a range of acute hospitals across both Wales and England, and our patients receive secondary care and specialist services from those sites. So moving on to just the reminder from the chair earlier about the really excellent news that we had at the start of the year that we're considering, that the World Health Organization made the official declaration of the end of a global emergency status relating to COVID, and that was back in the early part of the year in May. But clearly the impact and increasing demands on the services and how we address the backlog continues to be an issue for the service. It's also important to remember that we are still dealing in part with COVID, but also the winter respiratory vaccination programmes and important work around our health protection activities. So these include our flu vaccination, COVID vaccination, but also RSV, which is a respiratory virus. And I know we're very proud of how we have worked across the whole system, including our primary care partners, Powys County Council, PAVO, third sector, and with the communities. The public response in uptake for these programmes continues to be high, and we really very encouraged by the progress that we made throughout the pandemic and the continued focus on our winter respiratory vaccination programme. It has been hugely successful, and we're very grateful. In particular, just wanted to mention the volunteers, special thanks to the volunteers that helped us deliver. This has been recognised by an award, the commitment of staff in year, with particularly our school nursing service supporting this work around vaccination. They won the Health Board of the Year in the National Vaccination Saves Lives Awards, and this award was for achieving the best results in Wales in school-aged vaccination uptake rates. We also are very grateful to primary care for their continued delivery of the winter programme, as well as we have our midwives, very grateful for the work that they do to vaccinate pregnant women across the county. So really important work around health protection, and that still remains a critical priority for us with the emerging challenges that we're facing, such as monkeypox and measles. However, the impacts and some of the challenges of the pandemic are still very keenly felt by our patients and communities, as well as our staff and partners. The system is still recovering from COVID, and whilst we have made some progress to bring down waiting times for the services that we directly provide, we know that people are still waiting unacceptably long times for routine planned care. And I'll cover the progress that we've made around performance and waiting times later in the presentation. The other issue around the economic status of life generally is that cost of living and inflationary pressures are affecting everyone. And in terms of public sector delivery, we do face a challenging financial environment. And Pete, our Director of Finance, will cover this when presenting our financial accounts next. I also wanted to mention the really important role of the workforce. We do face a challenging recruitment and retention environment, and this is particularly affecting certain groups of staff. For example, our ability to recruit nursing and medical staff, as well as other sectors. We know the care home sector, domiciliary care sector, social care sector, and others are facing similar challenges. And also in relation to the county and some of the demographic changes, we also know that the proportion of people of working age in the county is continuing to reduce. The Chair's already mentioned the industrial action in the NHS in both England and Wales during the year, and the position with regard to a number of national pay disputes. But I am really proud and really grateful to how we have worked at a local level very positively with our staff side and trade union partners in managing the industrial action, its impact, and how we continue to work on a day-to-day basis closely with staff side partners to deliver the key issues and priorities across the system. So notwithstanding these challenges, we have now started to move back from that immediate urgent pandemic environment and response to refocusing back on our medium to long-term goals and our strategy. For those of you, just a bit of a reminder, we set our 10-year strategy back in 2017. This was the first joint health and care strategy developed across the whole system in Wales, and really was an important first step for the Regional Partnership Board in setting clear priorities for us. And that was done through conversations with both the public, patients, our frontline staff and partners within the county, but also those who work outside the county that we rely upon to deliver our services. So we do remain focused on delivering a healthy, caring Powys. But the context is much changed. Clearly, managing our response to the pandemic hit us for a couple of years, but I think the principles and objectives that we set have stood well against the test of time. We did find that during the pandemic period and going into this financial year that we had made really good progress, accelerated progress in a number of areas. For example, the use of digital technology to support patient care and more effective ways of working. But also it did have an impact in our ability to drive forward some of the priorities that we set. So the strategic priorities at the heart of the strategy remain what we're working to. So our commitment to focusing on well-being, early help and support. Tackling the big four is really important for us because these were identified through the evidence base as those areas which have the greatest impact on individuals' quality of life. Continue to drive forward on that. And also the important message is we heard from the public and from our staff that we need to make sure that our care system across health and care is as joined up as possible so that patients see that as one seamless delivery. And clearly, I've already mentioned the important role of workforce, digital, as well as actually the environment in which we work in. So the facilities we work within being absolutely fundamental to the delivery of the strategy. And fundamentally, we can't do this alone. So it's about transforming in partnership across the whole system with together with all partners, as well as with patients and the public. So my plan is to share just a little snapshot of our key progress and challenges within some of these priority areas. So if I start first of all in terms of just sharing with you our plan on a page. Our annual report outlines the important areas of progress that reflect the spirit of co-production and partnership here in Powys in delivering these goals. And I know that there's a lot of detail on this slide, and I will ask the team to share the links after the AGM to where you can read more. But it is really important today that you're aware that the plan on the page not only sets out our service, workforce and financial plans and priorities, but it was also embedded in how we can meet the key needs of the population, as well as delivering against the Welsh Government ministerial priorities that were set. So I'll start with focus on well-being, if that's okay. During the year, we have continued to make good progress in this area, and I wanted to particularly highlight one key area of work which we prioritised, which was around how we take forward a whole system approach to healthy weight. So we know being overweight increases the risk of developing a range of common health conditions, and our statistics in Powys is that half of all adults are overweight or obese. So we know also that the factors that influence weight are very complex, and there are a wide range of interacting environmental, social and economic factors influencing what we eat and drink and how active we are. So we decided to work as a public service board to develop a new whole system approach to tackle overweight and obesity. And this means that partners have been working together to understand how we can improve and take collective action across the county in ways that will help people to achieve and maintain a healthy weight. We've brought together colleagues from across the county and from different sectors to agree the areas that we'll focus on together. And after careful consideration, there were three priorities areas identified. So firstly, children up to the age of 5 and families, and also access to healthy food. And within these priorities, there's been excellent progress on breastfeeding, introduction to solid foods or weaning, cooking skills, and also the affordability of healthy food. We've shared focused on these programmes to help people to eat healthily, and also we've been very mindful of ensuring that we prioritise and target those with the highest needs. So we've taken a very clear approach to targeting activity in certain communities. Some of the examples include the Healthy Start scheme, which support eligible parents on lower incomes by providing financial help to buy healthy food and milk. And with uptake in Powys lower than had been hoped, our targeted campaign, for example, in the community of Ystrad increased the uptake of eligible families to 81%. We also had Bach a Iach, which is our healthy preschool scheme in Powys, and that has now focused on nutrition and oral health. And we've also launched the Food Rise for Life, which is a 9-week course offered through our dietetics team. And we're really pleased that we've had excellent uptake with 17 courses delivered during the year, and it's going from strength to strength. So you can find out information about these programmes on our website, including in the annual report of the Director of Public Health. Moving on to the priority of early help and support, and again, we could have chosen many examples. I thought it was very important to cover the important work that our primary care partners are undertaking in Powys. As I said earlier, primary care delivers the majority volume of activity in the health service, and it is the first point of contact for many patients. For awareness, we've got 16 GP practices across Powys, 16 optometry practices who provide eye care, urgent and routine eye care, 15 independent dentists, and 23 community pharmacies. Now, that is the sort of foundation of the delivery of the health service in Powys. And clearly, the challenges we faced earlier around some of the workforce challenges, training and development challenges, is also felt by our primary care contractors who are key partners for us. So the Health Board established the Primary and Community Care Academy during 2023-24 to support training and development needs of primary care contractors and to help support sustainability of services. So this includes general practice, dental, optometry and community pharmacy. And just a couple of examples really. I know that there's been a lot of work around particularly focusing on practice nurse education, but also practice management and administration. The roles are very tough in primary care, being the front door to the NHS, and how we further develop opportunities for training and development are really important. Alongside this, we've also had professional collaboratives developed with the range of contractors working much more closely with each other to deliver services for the population. And we've made good progress against the Welsh Government primary care model. This is a national model for Wales, and implementing and continuing to develop and mature our joint working across the services at a cluster level continues to be a priority. Moving on to the Big Four then, some examples here of progress that we've made. So the first one we've highlighted is the rollout of the community cardiology service, initially in North Powys, and we're currently looking at rolling it out into Powys. Really important, lots of demand, and really important that we can do as much as we can within the community setting. Tied to that, it's really good to see that we've had routine screening testing developed and utilised across primary care to detect heart failure, and also further strengthening of cardiac rehabilitation across the county. Talking about cancer, clearly, again, a really important impact of the pandemic, that people get access to cancer treatment as quickly as possible. And so we've been working alongside our partners to ensure that Powys patients have access to rapid diagnostic services. And also we've been developing very careful work to make sure that we are strengthening how we're tracking patients through quite complex journeys to the various providers in and out of the county. And cancer remains a really important priority for us to work again across the whole system with our third sector partners and others to make sure that we can further improve the availability of support and services. Mental health then was the other area I just wanted to highlight, which is, I know that you're aware of the national new NHS 111 Press 2 service. We're really pleased that that's successfully launched in year and that we're able to provide early help and support for people needing access for mental health issues. And we're also continuing, we've led the design, development and rollout of the National Silver Cloud service. What this is it provides support, online cognitive behavioural therapy, access to the people of Wales. And we know that that has been very well evaluated, and we have excellent feedback from people who've used those services, with a particular aim of reducing the demand on emergency departments, on general practitioners, the police, the Welsh Ambulance Service, and also mental health crisis services. And as part of that work, the Step Down project has also been established to develop an approach to enable patients with more complex needs to try and return to live in Powys. So I hope that gives you a little bit of a flavour of the continued progress that we're making against the Big Four. The next slide picks up one example, a really important example. I mentioned earlier about Powys being at the forefront of an increasingly older population, with 28% of our population over 65 years of age. So we do know that it's really important for us to prioritise this work. So we've done substantial work around falls prevention. This has been led by a therapy teams initially, and making sure that we have a multidisciplinary team consisting of health, social care and third sector, where we look at people who may be at risk of falls or have recently fallen, to see whether we can identify how and in what ways we can further take action to support those individuals to reduce the risk of falling. We've also had a strengthened approach around falls prevention generally in supporting care homes, and the result of that work, with working closely with Wales Ambulance Services Trust, is that we had found in year that the call out to incidents in care homes were reduced by 25%. So again, making a really important contribution really to trying to stem the impact on WAST and ambulance conveyancing, etc. So a really good example there of the work that we've been doing around joined up care. Moving on to the next slide, we've mentioned to you about the growing financial challenges facing us in the health and care and public sector more generally, and that the Health Board ended this financial year in consideration through this annual report in a deficit position for the first time since 2015. Those challenges have increased into this year, and whilst we did meet the target control total that was set by Welsh Government, this still represented a year-end deficit of nearly 12 million. So again, our Finance Director will share with you some of the detail a little bit later. But as the Chair mentioned, we have now been escalated as a Health Board from a routine monitoring status to enhanced monitoring for planning and finance. And it's very important that we remain focused on this, partly because this brings the need for us to have a dialogue with the public and with our partners about how we develop a plan and options for the future to develop and continue to deliver sustainable services to serve our population, but within the available resources and budget that we're allocated. As the Chair mentioned, we have remained in routine arrangements for all other aspects of Health Board delivery, things like performance, quality, safety, etc. But very important now that we can work together with you to develop a plan to sustainability. What this has meant is we've had more scrutiny from Welsh Government, more contact on our delivery and performance arrangements, and enhanced monitoring means that actually the frequency of our arrangements in keeping in touch with Welsh Government and being held to account at a executive and board level has increased in intensity. So the next slide is a busy slide, so I'm not expecting you all to be able to read this. It's if you just look at the colours, it gives you a bit of a sense of the red signify the areas where we haven't been able to meet target, and the green show the areas we've been able to deliver against ministerial targets. And I think you can see from the balance of the red and green as a quick visual indication that it has been a challenging year for us to deliver against our performance targets. So we have significantly improved plan care position on referral to treatment time in the context of increasing demand and referrals. So we achieved our target for the number of patients from primary into secondary care ophthalmology services, for example, and the number of patients waiting more than 52 weeks for a new outpatient appointment as a provider. But clearly we did not achieve the targets for the number of patients waiting more than 36 weeks. We reported 91 patients had breached that target, and also we did not meet our target to deliver patients waiting more than 52 weeks for treatment. Fortunately, 23 patients went over 52 weeks during the year. And then we also had a target around patients waiting more than 104 weeks for treatment. And again, unfortunately, we had one patient in that category. But clearly, there are other key improvements, including diagnostics, and we've significantly reduced our diagnostic weights, although there is still an ongoing pressure for echocardiograms. And therapies are also improved significantly. Again, we have one area which is particularly challenged around audiology, but you can see that we've made good progress. And this work relies on our ability to continue to have in-reach support from our neighbouring health boards, both in England and in Wales. And we know that there have been significant challenges for our neighbouring health boards in continuing to provide some of those in-reach services during the year. So my huge thanks for everybody's efforts around that. With regard to mental health services performance then, again, it has been challenging in the context of increasing referrals and demand, and we continue to move forward to improve the position. Those are the areas I wanted to highlight as a provider of services, but clearly all of our residents go to various acute hospitals in Wales, England, and we know that the long waits remain a challenge. So there has been some improvement from Welsh providers, but again, we are finding that is taking a long time to recover the backlog. So I'd like to offer my apologies to patients who are currently waiting too long for treatment, and to reassure you that this not only continues to be a key priority for us as a health board, but also in terms of the expectations from Welsh Government about eradicating those patients who are waiting the longest for treatment. We're continuing to work hard with partners to ensure that we can deliver that. The next slide talks a little bit about workforce. all I can say about this is the success of our ability to deliver health and care is completely reliant on our ability to recruit, retain and train and develop and hold on to our staff. So our current workforce projections demonstrate we are facing ongoing substantial vacancy levels within certain roles, and we do need to consistently look at how we organise through alternative means to address that. And you can see also that some information here, you know, nearly half of our nursing workforce, for example, is over 50, and therefore we, you know, our projections, we need to take some large scale action to improve the current workforce projections. Lots of work being undertaken, gives you a little bit of a feel for this around. We really do rely on, and I'm very proud of the work that we've done to bring in internationally educated nurses and internationally educated medics into the county, and I'm very grateful to their contribution to sustain our services, but also really pleased with the work that's been undertaken around our aspiring nurse degree pathways. Really important, and we've won a national award around this because it's been really a key ambition to grow our own workforce. We've also expanded our employee assistance and wellbeing offer, and again very much working with our staff side and trade union partners to support the ongoing support and wellbeing activities and hubs across the organisation. And a final point around the culture of the organisation. It's really important. We have adopted the NHS Wales Speaking Up Safely framework, and we have included on our Voice Hub, which brings together in one place lots of information about how colleagues can share feedback and raise concerns. And clearly acting upon the staff survey results that we receive will be really important, and that's now moved into an annual cycle where we take feedback from the staff and act in accordance with the feedback that we receive. Next slide is just to thank the staff and our partners for the significant amount of work that they've undertaken to be recognised in prestigious local and national awards and conferences. I'm really grateful for the time people take to develop and submit these nominations, because it really does help us to raise the profile of Powys as a great place to work and thrive. And the Staff Excellence Awards, absolutely brilliant. We had over 180 nominations received, and you can see listed here is the wonderful congratulations to all of the nominees, but also to the winners. So congratulations all. Next slide then just talks a little bit about our key challenge around our estate. We have an ageing estate. Many of our buildings were established before the NHS was established. And whilst this did mean that we've not been affected by some of the recent issues like the reinforced autoclaved aerated concrete issues that other health boards are dealing with and trusts are dealing with, we do have significant levels of backlog maintenance in facilities that were designed for the early 1900s rather than 2020s. So, you know, clearly our capital resources, we continue to be ambitious in trying to secure additional capital resource, but you can see our overall programme during this year was around 6.5 million. So this is a very busy area of work for us, and there's some really good examples of excellent developments that got over the line during that year, including Ysbyty Bro Dyfis, opening of the redevelopment of the area, the new staff car park in Brecon, as well as the increasing focus on garden facilities for patients and staff in Llanidloes and Welshbourne. It's really pleasing also to mention that we are making good progress to reduce our carbon footprint and to make more sustainable use of our resources, and really pleased with the progress we're making there. But just wanted to highlight in particular the kind donations that we've received from partners, charitable funds, particularly our League of Friends and other public donations. We are very grateful because some of these developments would not have been taken forward without their ongoing fundraising support. So many, many thanks for that. The next slide talks a little bit about our changes. I just wanted to thank the outgoing members and welcome new members to the board, particularly Carol Shillerbier, who worked in the county first as Director of Nursing and then as Chief Executive for just over 12 years. Joined Betsy Cadwallader University Health Board in May of this year. And, I'd just like to, on behalf of the board, pass on our sincere thanks for Carol's leadership and vision and dedication during that time. We also received really sad news in October of 2023 that one of our colleagues, independent member Mark Taylor, died after a short illness, and we share our thanks for his service to the board. Later in the year, we'll be joined by Nick Gianassi as independent member, and which has been great. And also you can see some of the changes since the end of the financial year. So just to again thank Ian Phillips for his term of office as independent member, which ended last month. Ian was our lead independent member for digital, and I would also like to thank him for his contribution over the last 6 years, and to welcome Steve Elliott, who's been appointed at the end of the financial year as independent member for finance. So whilst there hasn't been any changes in our executive team recently, we will be shortly saying goodbye to Stephen Powell, who joins Betsy Cadwallader as Director of Planning and Commissioning in October, and we will be joined by Nicola Johnson as our new Executive Director of Planning, Performance and Commissioning next month. And then joining later this month is Executive Director of Primary Care, Community and Mental Health will be Elaine Lawton. Really, again, wanted to put on record on behalf of the board our thanks to Steve Powell, but also to Joy Garfitt and David Farnsworth for leading key portfolios on an interim basis over the last year. So huge thanks to you all. So more information about the board and the governance arrangements can be found in the accountability report at section 2 of this annual report. I'm nearing the end, so I appreciate time is going on. So as we look ahead to 2024-25, we will need to focus on how we respond to the challenges around our ongoing options for the future of a sustainable Powys. And we recognise that the first months of this year, we've already had some challenges in this respect, given the need to engage with the public on proposed temporary changes to respond to the current challenges we face. And as the Chair mentioned, we'll be considering those on the 10th of October. And as the year progresses, we do anticipate there will be a need for further conversations, engagement and consultation to ensure that public, the patients, our staff and our partners are working together to address the issues we face here now and also to plan into the future. So, in conclusion, diolch i chi gyd i'n cydweithwyr, partneriaid, gwirfoddolwyr, cleifion a'n cyhoedd am ein cefnogaeth parhaus. I ni yn gwybod mae'r ffordd orau o afael ar heriau i ni yn gwynebu yw I drawsnewid yn partneriaeth, a dwi'n edrych ymlaen at ddeialog am y cyfleoedd ar gyfer y dyfodol dros y misoedd nesaf wrth I ni ddechrau ymgysylltu o biti model gofal canlyniadwy yn y dyfodol. So finally, I would like to say thank you to our colleagues in primary care, across health and care partners, both in Powys and outside the county, our volunteers, patients and our public for their continued support and wise use of our resources. We know the extent of the challenges we face will be best addressed through transforming in partnership. And I'm really looking forward to a dialogue about the opportunities for the future of the next few months as we begin engagement on the long-term sustainable model of care. Although I think we'll all agree that we can't deny that we have a number of challenges that we need to face head on, I know that I feel very optimistic that we can work in partnership, and that's partly because of the incredible passion, dedication, commitment that I see from the public, partners, staff, volunteers and communities, that we're all have that shared purpose of trying to deliver our vision for a healthy, caring Powys. So on that note, I'll hand over to Pete Hopgood, our Director of Finance.
Thank you, Hayley. Good afternoon, everyone. So I'm just going to take you through some key messages from the Health Board's 2023-24 annual accounts. So if we move forward to the next slide, please. In terms of our key financial performance targets, the first target, as you'll see on the slide there, is to remain within our revenue allocation. We failed against this target, which is a statutory duty, as we finished the year with an overspend just short of £12 million. That basically means that we spent more money than was allocated to us by Welsh Government. In terms of our capital requirement to remain within the funding allocated for capital purposes, we delivered against this target with a small surplus of £26,000. And then against the administrative target to pay all non-NHS creditors within 30 days, public sector payment policy, we just fell short against this target of 95%, with a performance of 92.5%. It is worth noting that that was an improvement on the previous year, but not quite enough to hit the target as set. Next slide, please. Just really a bit more detail behind the revenue position. There's a statutory duty to deliver a balanced position over a 3-year period to not exceed the funding allocated to a health board over that period. For the last 3 years, our performance has been in 21-22 a slight surplus of 80,000, in 22-23 an overspend of 7 million, and then as I just referenced in 23-24 an overspend of just short of 12 million. This gives us a cumulative overspend of 18.9 million over the period reflected. And just from that table on the bottom right, I just want to highlight that the total amount of that the health board has spent in terms of delivering and commissioning services for the population of Powys over the last 3 years is just over 1.2 billion. It's in the bottom right-hand corner of the table, at 1.213 billion pounds. Next table, please. On a similar basis for capital, again, we have requirements remaining within our capital allocation over a 3-year period. You can see the performance year on year in the table there. And for the 3-year period, we've delivered a modest surplus of £161,000. And again, a reference to the table on the bottom right, where you can see our total spend on capital for the health board over the last 3 years is £35 million. Move on to the next slide, please. Just to highlight, this highlights our public sector payment policy, where we just failed to meet the 95% target for non-NHS payments at 92.5%. Just to reference, we did actually make the target in terms of the value paid, where that was at 95.5%. Next slide, please. This really just gives you a breakdown of our total spend for 23-24 over our key expenditure headings. So those being expenditure on primary healthcare services, our general medical services, our dentistry services, ophthalmology, etc. Our expenditure on healthcare that we purchase from other providers. That also includes our continuing healthcare. And then our expenditure on our own provider services, our hospital and community health services. And as you can see, just looking at the table there, that our total spend in 23-24 was 446 million. That was an increase of circa 35 million from the previous year's total of 411 million. And the total at the bottom is basically adjusted for the income we receive. If we can move on, please. Just quickly, these next few slides show you a breakdown against those 3 key expenditure areas, and what we have is a comparison of 23-24 at the top against 22-23. And as you can see from the pie charts, our areas of spend have remained fairly constant year on year. So this is expenditure in primary care services, The blue shaded area is our main area of expenditure, which is in relation to general medical services. The green shaded area is our prescribed drugs and appliances, and the grey area is our general dental services. And as you can see, even though I referenced earlier that our spend has increased in total across the health board, the general proportion is similar year on year in this area. Next slide, please. Similarly then for our expenditure on healthcare from other providers, as I noted, this does include continuing healthcare. Again, you can see that the pie charts, the percentages are very similar. The orange box there is our services purchased from non-Welsh NHS bodies. So in the main, that will be our main providers in Wye Valley and in Shrewsbury. The grey area is expenditure against the Joint Commissioning Committee. That's our specialist services, those tertiary services which are purchased by that committee on behalf of health boards in Wales. And then the blue area there is our services procured from other NHS bodies provided by those other health boards in Wales and trusts, etc. Again, just to highlight that the spend in percentage terms and the slice of the cake in the pie chart has remained consistent year on year. Next slide, please. And then finally, in terms of our own provider expenditure, and these are the services that we provide ourselves in Powys. Again, comparison year on year. The blue shaded area is our spend on pay, but there won't be a surprise with them. The majority of our spend is in relation to our staff in terms of pay. And then those other areas again highlighted include non-pay, supplies and services, and depreciation. And again, you can see in percentage terms that movement in terms of where we spend on money has not dramatically changed. I will note that there's been some comments at the bottom of each slide giving some basic explanation of the movement in spend. I'm not going through those given the time we have remaining, but the slides will be available on our website for anyone wanting to look at those further. If we move forward, please. Okay, so our annual accounts are subject to audit by Audit Wales. And in relation to our accounts, the Auditor General has qualified his opinion on a regulatory basis for the Health Board. And this is in the main because we have not remained within our financial allocation. Because we've not broken even over in year and on a 3-year basis, this leads to a regulatory opinion. And that is what's been made by the Auditor General. Pleasing to note, though, in terms of the true and fair view and the accuracy of our financial statements, this has had an unqualified opinion, which is a positive thing, and that is means that our statements are true and correct. If we move forward, please, I think that repeats that in some way. The next slide. So just to give a quick conclusion in terms of finances. So the Health Board has met one of its 3 statutory targets for the financial year 23-24. That was to remain within our capital resource limit. In terms of revenue resource performance and approval of a 3-year plan, that was not met. And as I said, the Auditor General issued an unqualified audit report in terms of our financial statements for their true and fair opinion. That concludes my quick overview of the annual accounts. I'll now hand over to Helen Bushell. Thank you, Helen.
Diolch yn fawr, Pete. Helen Bushell, Dwi Prawn Fawr, everybody, Director of Corporate Governance for the Health Board. And I'm just going to help us by facilitating some of the questions that we've had in from members of the public and colleagues that have joined the call. So thank you very much for those. Just before I do, just to say, there is still an opportunity if you want to add any more questions into the question and answer panel, please do that. And even if we can't get to them all today, we will publish them on our website afterwards. Just to also say the full annual report, as well as these slides, will be available on our website, and we'll post links to that through our normal channels on the website and social media, but also in this chat later on today as well. So I'm just going to start off with one of the questions that we've received from colleagues and members of the public that have joined the call. And Claire Roach, I'm going to come to you first, if that's okay. Claire, you're our Executive Director of Nursing Quality, Women and Family Health. So thanks for joining us today. So one question we've had then is in relation to recruitment of nurses and the difficulty sometimes we have in doing that into substantive roles and therefore improving patient safety. Can you tell us what we as a health board are doing to overcome perhaps some of those difficulties, if indeed you see them as difficulties? Thanks.
Yeah, thank you, Helen. Diolch. Good afternoon, everybody. Prynhawn da. So overwhelmingly, our focus as a health board is to really focus on reducing our substantive vacancies and recruiting into substantive posts and minimising our reliance on agency staffing. And that is our core primary objective. We've been doing that in a number of ways, and some of those have been referenced to in Hayley's presentation this afternoon. So first and foremost, I think it's really important to say that we recognise that there are multiple lanes to come into nursing from an undergraduate perspective. So we work with the University of South Wales, we work with the University of Aberystwyth in terms of those more university-based routes into nursing. But importantly, we recognise that actually there is a requirement and a demand to come into nursing through much more flexible routes. And Hayley has already referenced the numbers of nurses that we've had that come through our aspiring nurse programmes, because there's more than one programme, and we work really closely with the Open University and indeed the University of Bangor. So I think that demonstrates the fact that, you know, it's not a one size fits all, and that we need to be able to maximise in the multiple swim lanes into nursing. And really, as a relatively small organisation, we're working with a multiple of university partners to maximise that opportunity, and we will continue to grow that. Our other focus has been on internationally educated nurses, so we have been part of the All Wales Health and Education and Improvement Wales programme to be able to bring internationally educated nurses over into Wales. And in the last 18 months, we have had huge success with that, building from initially just bringing one or two nurses in a delegation to more recently we brought in 6 nurses, and we've got plans now over the next couple of months to bring those nurses into our relative areas of the health board. I have to say that they are a huge asset to our organisation, bringing diversity and bringing cultural awareness into our organisation. They have all settled absolutely brilliantly, and I would like to take this opportunity to thank the people of Powys who have welcomed them into communities and really cared and looked after them. And I think that is a testament to our communities of how kind and caring they are. Of course, it is really important to recognise that there are challenges, and we do need to monitor the safety of our services. And as just one example, because there are many and too many for me to talk about in a small chunk of time, if we take our inpatient services, for example, we monitor our staffing levels regularly. We have got a number of tools such as the Welsh Levels of Care and another application called Safe Care, all of which enables us to track our staffing levels. And we triangulate those with reported incidents, with concerns or complaints that may come into the service. So we can particularly look at, is there anything in relation to our staffing levels that might be actually directly impacting patient safety and care? So that's a very whistle-stop tour. I could talk about this all afternoon, but I will stop there. Thank you.
Oh, diolch yn fawr, Claire. Thanks ever so much, and thank you very much for the person that asked that question of us. And then one other question that we've had, and Hayley, I'm going to come to you as our Chief Executive Officer, if that's okay. And this is in relation to the pay deal. So, as we know, there have been some announcements this week from Welsh Government about this current year's pay deal. This is in relation to last year's, the 2023 pay deal. And the question is the board confident that the elements agreed as part of non-pay elements from that 2023 pay deal from Welsh Government will be implemented? So it's particularly the non-pay elements, if you have any comments, please.
Thanks, Helen, and thanks for that question. This is important because the non-pay parts of the collective agreement that covered, I think, 2022 to 2024, we have had correspondence from Welsh Government around that. I think it was April of this year, setting out very clearly what we needed to do in relation to three parts. First, immediate assurances. Second part being around being able to demonstrate where we are around the baseline report. And that was by the end of May, I think, this year. And then going into later in the year, in January, we're expected to deliver a outcomes report. And that purpose is around, so the action plan that we've put in place, we had to sign that off through our local partnership arrangements in partnership. And, you know, it's about then demonstrating and submitting to Welsh Government in January of 2025 where we've got to against that plan to particularly share best practice and to identify future national priorities. So what I would say is that a number of the elements in the plan are not just for the Health Board to deliver. It also relates to national activity as well as some local responsibilities and assurances that we need to deliver against the progress in the implementation plan that we've agreed. So I think we'll make good progress. I think in terms of the number of actions that relate to more strategic national activity, then that would probably, January would be the time where we could understand whether it would be fully completed by the end of the financial year. But I know that this is a key priority that's been set clearly to us as Health Boards, and Welsh Government want to make good progress on this. So what I would say is the local arrangements and the responses to Welsh Government in line with our own local actions, we've got a clear plan to deliver against those. However, in terms of giving the assurance, I think we'd have to wait until the January 2025 outcomes sharing of that information to understand whether we've delivered all aspects across both national and local action.
Lovely. Diolch, Hayley. Thanks ever so much for being clear about that, but also very honest about where we are and some of the complexities and when we may expect to hear a bit more about that. So lovely. Thank you very much for that. So Carl, I'm going to hand back to you as our chair of the board and chair of this meeting as well. I'm sorry if I have missed any questions that colleagues and members of the public have asked. We will keep an eye on the chat, and if there are any that we haven't answered, we will make sure that we do so via our social media and website mechanism. So thank you, Carl, back to you.
Diolch Helen, ac wrth i ni ddod ar cyfarfod yma I ben ac wrth I ni gloi, dwi am ategu gair falle at y sylwadau a ranwyd gen ein prif swyddog gweithredol Ginne yn y cyfarfod. As we bring this meeting to a close and to its conclusion, just a word to add to the and to build on the observations made by our Chief Executive earlier. I, on behalf of the board, want to express a sincere gratitude to the staff colleagues across the whole organisation. Whatever your role, certainly when I get out and about and meet people and the Vice Chair and other independent members, I am constantly struck at the tireless way in which you provide high quality, safe services for our population. And I simply want to say that's noticed and deeply appreciated. Thank you very much indeed. Ac hefyd, dwi am ddiolch i'n cydweithwyr ar y bwrdd hefyd, cydweithwyr annibynnol ynghyd â chydweithwyr gweithredol. I think it's also important for me to say a big thank you to my board colleagues, both independent members and executive members. Thank you for your time and diligence and your high quality contributions. Your expertise and your professional, wise and intelligent counsel that has supported our navigating of what is an increasingly complex landscape. And so your contribution, your participation and your colleagueship is certainly very, very valued and much appreciated. And of course, our work continues. We know that there are significant challenges ahead and very important and difficult matters that will come our way over the next months and years. But on behalf of us all, I want to publicly commit ourselves to continuing that difficult work and to serving the population of Powys to the best of our abilities. But for now, that concludes the business of our AGM. Thank you to everyone that's worked behind the scenes in preparing for today and making today possible. And that is, again, much appreciated. But for now, thank you and goodbye.